Hello and welcome once again to the Before We Agree to Surgery series. This is a space where we pause for a moment before making surgical decisions and try to understand what options may exist. Today's conversation is particularly special for me because we have with us Dr. Uthappa from Bangalore, one of the most respected and senior interventional radiologists. I have personally known Dr. Uthappa for many years now. In fact, our journey goes back to around 2018, and it has always been very inspiring to see the incredible work he has done in this field. Doctor, it is truly a pleasure to have you with us today.
Thank you, Sumi. I'm really happy to be on this platform and really looking forward to this interaction. It's always heartening to know that like-minded people can really make a big difference to patient care, and I would look forward to this interaction and hopefully address issues before patients need to go for any surgery.
Very true. So today we are going to talk about something that affects a very large number of men as they grow older: prostate enlargement. Many men silently struggle with symptoms like frequent urination, especially at night, weak urine flow, difficulty emptying the bladder, and often the first thing they hear is surgery may be eventually required. But before we agree to surgery, there are always questions we wish we had asked. So yes, doctor, prostate enlargement, though it's very common among aging men, yet people don't talk so openly about it. Could you help us understand how this condition occurs and what would be the symptoms that they should be able to identify?
Like you said, enlargement of prostate is almost a physiological, part of growing up. I probably wouldn't say part of aging, but part of growing up for men, and it's obviously a problem unique to men. And we are aware that women can have problem with the waterworks. Similarly, men can have problem with the waterworks. And the early symptoms would be that, like you just alluded to, for example, you may have difficulty in passing urine. And that difficulty in passing urine can be in a wide spectrum. And they may notice that the stream is poor. They may feel that they have to rush to the toilet, or sometimes they feel incomplete emptying. For example, they get a sensation, they want to go past urine, but they come back and they want to go again. And as the symptoms keep progressing, and if they have not noticed that change that they are having, because it's very difficult for a patient per se to know that I'm seeing a different trend. But then it would reach a stage, God has designed all of us with some safety limits in different parts of our body, and similarly with the prostate enlargement, there is a safety limit. But once the frequency of urination becomes a problem, there is a need to rush to the toilet. So generally, I will pick up the patients who really need to, reach out to a doctor. Would be the time when they are very aware of where the toilets are. For example, they go to a public place and they feel that they really need to go and empty before they can interact socially. So those are the early symptoms that they should look out for. And then the other spectrum of patients would be that they start to having to get up at night. So generally they're a good sleeper, but they've gone and emptied their bladder before going to bed, and then they have to wake up in 2 to 3 hours. So that is what we call a nocturia, getting up at night. So that could be an early symptom for some. And also, sometimes if they are adapting to these changes, they may also get sometimes something called urge incontinence. That basically means that they don't find a suitable place to be able to go and empty the bladder, and they may, have a few drops, leaking into their underwear, and that could also be a symptom that they need to look out for and then reach out to a doctor. So broadly, we have summarized it into something called IPSS. It is called International Prostate Symptom Scoring. And there are tools available now. So what I would suggest for elderly men who are seeing some problem with the waterworks, log their symptoms and then reach out to a doctor, and we can score their symptoms. And based on the scoring, we can then alert them to go to take a specialist, review and a consultation.
So where would we find this scoring methodology, doctor? Is it available commonly for a
Well, like it or not, lot of this is available on, many AI tools are available on the internet. Chat GPT people use and different other portals. So what is important is the moment they have some symptoms, they can reach out to a urologist. They can reach out to an interventional radiologist who will understand their symptoms and then objectively do a scoring system. So the scoring system will help us to triage the patients who need to be intervened in some way. So I think one is to be aware of what are the symptoms, and then to seek an early consultation with the urologist or interventional radiologist today. Both would be totally, suitable options for patients, who have any difficulty in passing urine.
Like you said, reaching out to the doctor. At least when it comes to the older men, though they go through these symptoms, one, they feel like it is my part of aging. Or it can be also that I don't want to trouble my families. Why I should trouble them? Why can't I adjust this myself? Most of the men who are elderly, they usually think that way. They don't put their health first, but eventually they reach to a stage when they are not able to manage and they ask for help. What would you say to such men? What would be your advice?
Clearly, with the symptoms progressing, we have to really kind of make them aware that neglecting a symptom for too long is not good. Because once the prostate enlargement causes these kind of symptoms that we have discussed about, they can then start affecting their bladder capacity. And then if further delay in diagnosis or adequate treatment, it can have back pressure on their kidneys and affect their kidney functions. And as men get older, they could have other comorbid situations like diabetes, hypertension, vascular ischemic heart disease. So all those cumulative factors and a bladder which is not emptying fully could have knock-on effects. So I think prioritizing their own health would become of utmost importance, that they should certainly get the consultation done, because we don't want to have the secondary effects of an incomplete bladder emptying issues having to affect the kidneys. In addition, as men get older, there is a slightly increased incidence of prostate cancer. So the prostate enlargement may not reflect only it's a benign disease. The fact that they go to a doctor will also, make sure that they get a screening of a blood test called PSA, which is one of the tumor markers we detect, early detection of potential prostate cancer. So not only that they are going to safeguard themselves from the prostate-related symptoms, but also get a test which will prevent, a possible chance of having a prostate cancer. So it is extremely important that they prioritize their own health in addition to being there for their family. Yeah.
Very true. Very true. I agree on that, doctor. But I think it's not just that, okay, I need to go to the doctor. I think it's also the fear. What if I'm being suggested a surgery? If I have to go through a surgery, who's going to take care of me post-surgery? What all post-surgical recovery I need to go through? What are the pain which I need to go through? So, do we have only these traditional surgery methods, or is there any other option available? And if it is, how different it's going to be from the traditional ones?
Right. I think you brought up an interesting point, which I think I have seen a lot of patients come and share with me. One of the common ones is that they say, one of my neighbor or a family friend, somebody had a surgery for an enlarged prostate, and it was real hell for them in their own ways, that their terminology they use. And because, the recovery was a challenge, they didn't like to stay in the hospital for too long. So clearly, being scared of surgery is a reality today. And I think not only with prostate-related symptoms, many other areas we see this. So yeah, I acknowledge the fact that they are scared if at all surgery is going to be recommended. But I think what is really heartening to know, in the year 2026, we can confidently say that we have a non-surgical treatment option for enlarged prostate for elderly men. Even younger men who are very symptomatic, they have a non-surgical option. And the technique has evolved to a stage that we can actually recommend this openly to general public today, saying that if you have an enlarged prostate and we have done your initial diagnosis, your symptom scoring, and you are one of those who may be suitable for a non-surgical treatment option, we can strongly recommend that. And coming to the point that you said, that what do they involve? Really, the treatment that I'm going to talk about is something called prostate artery embolization. Essentially, embolization as a general interventional radiology procedure is where we cut the blood supply to a particular abnormal area in the human body, whereby that abnormal tissue gets treated. Either it could be a cancer or a non-cancerous. In prostate, it is benign disease. So you have an enlarged prostate, which is causing the problem with your water works. And the prostate artery embolization as a procedure is designed to cut the blood supply to the enlarged prostate part, which will then shrink and let your water works get back to normal. It will take a few weeks for it to get to normal, but you have a well over 90% chance that it will get normal. So a non-surgical option, which is extremely safe, is available for elderly men who have enlarged prostate, assuming that we have done the preliminary workup and see they're suitable. I think this is an important thing that we also need to convey, that not everybody would be suitable for prostate artery embolization, but majority of them will be suitable. And I think it's important for men to really take home the message that they don't need to be scared, because today we have a technique called prostate artery embolization, which will solve their problems completely in majority of the cases. So without surgery, essentially a daycare procedure they can have, which is done under purely local anesthesia with far, far lesser complications when compared to the traditional surgical option that is available. So yeah, it's an option that they should very confidently explore and to see if they're suitable for something like that. Yeah.
It's so wonderful. Patients don't have to go through the general anesthesia, go through OT, no cuts, no stitches. Especially being a little sensitive area, there's a lot of pain which they have to go through, if they have to go through a traditional surgery. I think it's just the awareness is required that yes, there is an alternative also exists for men to at least explore the option and find out if they are suitable or not. So since you said young men, and it's not only aged men, young men also see symptoms of enlarged prostate. But even though when they are told surgery, the first thing comes in their mind is what could be the side effects? Because obviously when in Google or the first thing which we go is the first doctor, as everybody says, is Google. Now it's turned to ChatGPT. So it generally says traditional surgery for prostate can affect your sexual lifestyle too. So how do you say if this option, as you mentioned, prostate artery embolization, is there any side effects for this procedure?
True. So when we started doing prostate artery embolization, we initially offered it to men who are elderly with enlarged, very big prostate, where a traditional surgery may not yield a very good result, or patients who are very elderly who are not suitable for surgery. For example, they need a general anesthesia for surgery. So we selected patients who are elderly, not fit for surgery, or a very, very large prostate, something like more than 80 grams of prostate, normal being 25 grams, and if they're symptomatic. But as the prostate artery embolization became an established technique and people started seeing the benefit, now we have a lot of younger men coming. We are talking of men even in the age of 45 to 55 to 65 age group. Like we are aware, one of the ways to remember the incidence of prostate enlargement. We normally see if you're age 50, you have a 50% chance. If you're age 80, you have an 80% chance of having an enlarged prostate. It is that common. But how you manage your symptoms also matters. So even young men at the age of 50, they have a 50% chance of having an enlarged prostate. And of that, some of them will have severe symptoms. And for them, the thought of having surgery is nerve-wracking, because one of the complications of a traditional surgery, even though surgery is very safe, it's been the gold standard for all these years, it still can cause a problem with the sexual lifestyle, especially if they're sexually active men. One of the common problems is, apart from the surgical recovery, they also have something called retrograde ejaculation, and that can hamper their sexual functions, and that could have a psychological effect. So for these men, prostate artery embolization becomes an extremely good option because they don't want to compromise their sexual active life. So they will greatly benefit by seeing if they're suitable for PA. At least they can get a prostate artery embolization till let's say it has a life of let's say 15-20 years. They even if let's say they have a prostate artery embolization at the age of 50, and let's say at the age of 70 they have a re-enlargement approach, they can have a repeat procedure. So that's the beauty of prostate artery embolization, that it can be repeated for younger men who would continue to be sexually active even in their 70s, for example. So for younger men, it became particularly more attractive to consider a PAE today.
That's very interesting to know, Doctor. So I would like to ask, as a closing advice, what is that advice would you give to the men? I'm sure, there'll be a lot of patients who will be watching this. What is that they need to look for? And how will they know, yes, though you said there are a lot of schools available, I'm a right candidate or not, to check on that. But what is that they should keep in mind as an advice which you give to our patients today?
So I can share the journey where I was. So I did the first prostate artery embolization in Bangalore in South India in the year 2016.
2016?
So it's almost 10 years back. Today we have done hundreds. Yeah. So today we have done hundreds of procedures. So today I can confidently tell any elderly man or even a younger man who is having a prostate-related symptoms which Dr. Google or ChatGPT alerts them to, they should seek an interventional radiologist opinion in addition to a urologist opinion, because with two opinions that they get, they can then decide for themselves, are they suitable for a prostate artery embolization? Because if prostate artery embolization is a good option for them and they undergo the procedure, they can avoid the surgery, they can delay the surgery, and for some patients, this could be a one-time procedure which can solve the problem related to water births. It also makes them aware and obviously share among their friends and family that they have an option that they can confidently explore. So today in 2026, with the 10-year experience that I personally have been involved with patients with enlarged prostate, we can confidently say that, for example, initially I would say you should go to a urologist first, and if they see you suitable, you come to a interventional radiologist. Today I can tell a patient that you go to an interventional radiologist in wherever you are and take an opinion from them. And an opinion will involve a complete assessment by the interventional radiologist, because the interventional radiologist, like a urologist, fully understand what are the symptoms to look at for, what is the workup that is required. For example, if a patient comes, we'll do an IPSS scoring, we'll get a uroflowmetry done, we'll do a test, importantly a PSA level, and then some of the patients we will see if they are suitable for prostate artery embolization. And now some schools will probably go for it angiogram, but some schools, like the way we practice, we'll do a CT angiogram. So we'll do a complete assessment to see if the prostate artery embolization is suitable for the person. So in the nutshell, I think we should confidently tell anybody hearing out to us that they should seek an interventional radiologist opinion in the geography that they're coming from. At least they can do an online consultation with the interventional radiologist who has an expertise in PA, and then meet the urologist in addition to the interventional radiologist, and then come to a decision as to what kind of treatment pathway they should choose.
Very true.
So the message is,
yes,
in one line would be, sorry to interrupt,
please go on. No, please go ahead, Doctor.
I think we should say that they could seek a urologist opinion and an interventional radiologist opinion,
Yes.
so that they're fully informed as to what decision they should take.
Absolutely, Doctor. What I was trying to say when you were sharing your thoughts, it just reminded me of a small story. A long time ago, my uncle, he had this enlarged prostate issues. Obviously, at that age, we didn't know what enlarged prostate was, and we obviously didn't know there were a lot of other options. But he used to very jokingly say, I do a lot of walking during nights. So basically, he kept using restroom, and I asking like, why you keep getting so often in the night. So that's the answer he gave me at that time. I didn't understand, but I'm sure there are a lot of men and families there are today who are silently suffering through this symptoms, and it's high time they get to know about this procedure and come out and talk about these symptoms freely, and chat with the doctor to find out if this option is available for them.
Totally agree with you.
So yes, doctor. So I know you've shared a lot of the thoughts and what would be the advantages, but I would still like to know, or I'm sure the patients would like to know, what would be those key advantages of prostate artery embolization compared to a traditional surgery.
Yeah, I mean, so basically, what really matters is number one, I think once we have given the patient makes a choice when they're fully informed. Then coming to the key advantages are, number one, they don't need general anesthesia. Number two, the risk of bleeding and infection when compared to surgery is extremely low, almost zero.
Wow.
The risk of retrograde ejaculation for sexually active men is a significant one, which is again virtually zero with PAE. They're able to get back to work much faster. For example, a prostate artery embolization done as a daycare procedure. We use the radial artery access. So they come in the morning, they get the procedure done. It takes about an hour and a half on a good day to get it done. And they go home the same day. There's very little painkillers required after the procedure. They start to see the improvement in about a week. By the third week, they're able to really make a difference to their waterworks, whatever symptoms they were having. And the other big advantage is that it doesn't deny them from having a surgical procedure if required. Let's say they're in the unlucky 10% group who don't get the expected result, they can still have a TURP or any other surgical procedure. And another advantage for young men who are sexually active is that they can repeat the procedure 10-15 years later if required. Because like in surgery, a prostate can regrow. For example, we have seen patients who've had surgery, they come back with enlarged prostate after 10 years. Then we don't do a PAE for them. Even if you have a PAE, it doesn't deny you from another PAE after 10 to 15 years if required. So these are the key advantages. Like I said, all the risks of surgery can be avoided. Daycare procedure, they can go back to work, and they can avoid a surgery for their life in a majority of the cases.
True. And if I may, I can add one more to that, since you said for people who feel, they might be a burden post-surgery, for people who think that way, it's like they can just, as you say, if I'm not wrong, they can walk immediately after the procedure. Can I say that?
Yes, pretty much. I mean, they would have had a little bit of sedation because, during the procedure, it can take an hour lying down in the cath lab. They carry a little restless. So there's a mild sedation given. So normally what happens is they go to the post-procedure room in a trolley. Then they go in a wheelchair to the ward in a couple of hours. We tend to discharge the patient by 4 p.m. Let's say we start the procedure about 9 a.m. By 11 a.m. we are done. They are in their ward by about 1 p.m. By 4 p.m. they can go home. So it's a very, very patient-friendly procedure. That's why I think it is much more easy for them to undergo when compared to traditional surgery.
Absolutely. So I don't know. They don't have to depend on anybody post-procedure. They can just continue their normal life. Right. Thank you, doctor. Thank you for giving us so much clarity. Thank you for taking out so much of time with your busy schedule. It means a lot to us that you have taken so much of time, especially for this patient, to create more awareness about this procedure. I don't know how to thank you, but thanks a lot, doctor. So yes, I'm sure this conversation will help many men and their families better understand their options and make informed decisions. For those who are watching us, if you or your loved ones are experiencing symptoms related to prostate enlargement and would like to understand whether prostate artery embolization may be suitable, please feel free to reach out to us. You can call the number mentioned on the screen or visit our website nosurgeries.in powered by Medac. Our team will be happy to guide you and connect you with the right doctors. We will also be sharing many such more conversations with you. So stay with us on the Before We Agree to Surgery series, and we will see you soon.